cell research. Stem cells are undifferentiated cells derived from human body or embryo. These cells have the capacity to replicate as well as differentiate into different types of tissues. So when the cells are introduced in the diseased or damaged organ, they replicate and differentiate into the cell type of that organ and thus replace the damaged tissue. Stem cells may be unipotent, that is, those stem cells which have the capacity to differentiate only into one cell type, only one cell type, a specific predetermined cell type. For example, bone marrow stem cells which can differentiate only into blood cells. The pluripotent, that is, those stem cells which have the capacity to differentiate into more than one cell type. In a desired cell type, the types of stem cells, that is somatic stem cells. These stem cells are basically unipotent stem cells derived from the body tissues. These cells are undifferentiated cells present virtually in all organs or tissues of the body of fetus, child or adult. Example, bone marrow, blood, adipose tissue, umbilical cord, placenta. These cells have a limited capacity of differentiation. They will differentiate into the cell type of the organ in which they are found. The somatic stem cells can be genetically reprogrammed to develop pluripotent cells, or also known as induced pluripotent stem cells, derived from blastocyst, especially inner cell mass of human embryo in vitro. These were discovered by John Thomson in 1998. The uses of stem cell therapy must be for therapeutic purposes only. Degenerative disease of the brain, spinal cord injury, heart, MI, bone marrow transplantation for leukemia, and diabetes, cancer, Parkinson's disease, Alzheimer's disease, autism, dementia, spinal cord injury, total body injury. The regulation of the stem cells research, that is US FDA, that is United States Food and Drug Administration, DCGI, that is a drug controller general of India, have approved clinical trials of stem cells for the treatment of acute MI 2009, osteoarthritis in 2011. ICMR and Department of Biotechnology have jointly revised National Guidelines for Stem Cells Research 2017. The clinical trials using stem cells should be compliant with the Schedule Y of Drug and Cosmetic Act 1940. Okay. Next is about the ethical issues. That is informed consent. The video is mandatory before taking biological samples for isolation of stem cells. The screening of 6 major transmittable diseases: HIV 1, 2, HBV, HCV, HTLV 1 and 2, cytomegalovirus, trypanosoma pallidum, is mandatory. Strong objection for the destruction of the human embryos in the name of the research. Cord blood bank. Baby's cord blood contains hematopoietic stem cells. So private cord blood bank have been established, which give an option to expectant mother to preserve cord blood for her baby. They freeze cord blood for their baby. They freeze and store the cord blood until the age of 21. This practice is ethically questionable. Private, the cost of a private cord blood banking is out of reach of the poor. That is in social injustice, and also the quality and vitality of frozen cell is poor. Cord blood banks are permitted only in licensed institutions. These have been registered with the DGCI, DGC and CDSCO. The private storage of the cord blood stem cells is advisable, and there is an elder child in the family with a condition treatable with this cells, and the mother is expecting the next baby. The cord blood is currently used to treat patients who have undergone chemotherapy to destroy their bone marrow due to cancer or other blood related disorders. Some clinics claim stem cells therapy are as a very safe option for the treatment of degenerative disease. These clinics lure the patients by publicized claims of success of stem cell therapy. Patients approach uh, these doctors as a last resort. The multiple injection of stem cells are given in the damaged organ. The ethical stem cell therapy has been following a declaration of Helsinki human experimentation, according to which stem cell therapy can be utilized for conditions which have no other treatment available. Medical legal issues, regulation, intellectual property, the safety and the risk. Sometimes this stem cells can cause tumor and other consequences also. Thank you.